Okay, let's go ahead and get started. Welcome. Thanks for joining this session. I'm Alana Barton, and I'm the Director of Media Programs for PRB. And today I'm going to talk to you about our work training young people to create programming for radio stations across Malawi under HP+, and how it led to whole community engagement in improving youth reproductive health, including access to family planning. I want to make a couple of requests before we get started. We will have time for Q&A at the end, so if you think of a question as I'm talking, please feel free to type it into the chat so we can discuss it later. And also, please keep yourselves muted just so we can lessen distractions. So a little bit of background about this program. In 2015, Malawi adopted a national youth-friendly health services strategy to improve health service access for the country's young people. But for the policy's goals to be met, communities had to know that the policy existed and what it said. So we wanted to ensure that health services and health policies aligned with the real needs and concerns of youth. And we did this by equipping young Malawians to advocate for themselves and to break down barriers to reproductive health-focused conversations among youth and between youth and other members of the community, importantly. When about half of all Malawians are younger than 18 and about 2/3 are under 24, youth really means most Malawians. So I have a question for the people who are on the session. What are the reasons that come to your mind when you think about barriers to youth FP use? And I'm going to give you just a few seconds to type your responses into the chat. It can be a word, it can be a phrase. What are the barriers that you think of to youth FP use? Stigma, absolutely. Multiple fans of stigma. Any other ideas? Yes, provider judgment and shaming. Also, yes, excellent answers. It helps to have experts in this subject on the line. So a lot of these that are coming in are the reasons that youth don't use FP in Malawi as well. So I want to talk about how we worked through those in our approach to this activity. So I'm going to briefly describe the approach and accomplishments of the program and show what happens when youth have the mandate and the tools to tell stories about reproductive health that are most important to them. We started by acknowledging that FP isn't just about preventing pregnancy, and it isn't just about choices made by individuals and couples. FP connects to many social and cultural realities, and use of FP is influenced by a whole ecosystem of factors and people, especially among youth whose views are still being actively shaped by those around them. So why radio? Well, because it's the most popular form of media in Malawi. We could reach the most people across the urban-rural divide and overcome barriers such as limited literacy and access to technology with radio. We started our training in 2017, and we started by forming long-term partnerships with 7 community radio stations across 5 districts in Malawi. Each station designated 1 to 2 senior reporter mentors to work with the youth journalists. And each week, with a Malawian researcher, we produced a bulletin about a different youth reproductive health theme. The bulletins include an overview of the weekly theme, current facts and data for the topic, a short resource list, and reporting tips and source contacts to get our youth journalists started. These bulletins were really about connecting the dots. The youth reporter and mentor teams then decided the most relevant way to cover the topic for their area. And one of the reasons this activity is so effective is its decentralized structure. The bulletins are a springboard to context-specific content, but they're not a prescription for that content. To create their programming, our youth journalists need to get into their communities and ask questions. So they visit youth-friendly health service sites, and they gather monthly data on services provided and make relationships with the people who work there. They speak with traditional leaders and local officials about what existing policies say, and they challenge why sometimes those policies aren't enforced. They engage with parents and teachers groups, as well as religious groups. And this represents a real transformation in who's driving conversations about youth reproductive health, and even whether those conversations happen in the first place. Many of the topics we've covered over this program's lifespan, from teen pregnancy to forced marriage to HIV prevention, are traditionally shrouded in taboo and stigma, the word that a lot of you use to describe barriers to FP use. A critical part of what made this program successful was simply giving youth a mandate to ask questions and to collect evidence, facts, and personal stories around little discussed topics. Their actions and teamwork really opened channels of communication among many different groups within the communities and motivated these groups to not just talk about these things, but to see that change was possible and to get involved. Among the most consistent drivers of that involvement were the youth listening clubs that formed in each of the communities we worked in. These groups would hear the programs together. They would talk among themselves about what problems were exposed and how best to address them. And then they would lobby community members for support in that problem solving. These groups continue to be very active and are hundreds strong in each community. I want to talk about some of the results this program has achieved, all of which are sustainable. Our partner stations now have a permanent orientation toward reproductive health coverage and inclusion of youth voices. And I think we've seen that commitment even as our support winds down. In fact, some of our stations, even though they're no longer receiving funding, have continued to send us reports on their activities. We've worked to combat stigma and harmful gender norms by addressing them directly. Programs in all our districts dug into the root causes and consequences of teen pregnancy, for example, including how imbalanced decision-making power and disproportionate consequences of unsafe sex for girls result from harmful gender norms and stigmas. In 2 districts, the numbers of teen pregnancies reported by youth-friendly health service sites dropped by more than 20% in the months after these series aired. We've seen increased uptake in youth-friendly health services directly following our programs. When visits to youth-friendly centers dropped off during the COVID-19 pandemic due to fear and misinformation and people being quarantined, PSAs and programs about new hours at youth-friendly sites and service protocols at those sites resulted in visitor numbers quadrupling in several districts. The programs have improved service access. At least 13 new mobile clinics have opened in underserved areas because of programs about high numbers of teen pregnancy and child marriage due to lack of FP access. Youth-friendly health service coordinators credit partner stations reporting on reproductive health service deserts for that change. We've seen community engagement from new corners, and this is really one of the strongest and most overarching results. Project partners and stations initiated the formation of nearly a dozen father groups, which had never existed but are modeled after longstanding mother groups, which are community support networks. And they did this with the goal of uniting male community members, specifically to teach boys, but boys and girls both, responsibility and reproductive health choices. Father groups have organized discussions for boys about safe sex and informed decision-making, about respect for girls and relationships, and they've also engaged the boys in community service projects across our districts. Lastly, we've seen accountability raised through this activity. Traditional leaders in one district form groups to track and prevent child marriages after hearing about their lifelong consequences for girls on the radio. These leaders have started working directly with parents and families to convince them not to marry off their daughters early, and several dozen early marriages in the district have been dissolved or stopped so far. So at the start, just a few minutes ago, I shared a slide with the names of some groups that influence FP decision making. During the 6 years of this program, many of these groups have gone from actively opposing youth reproductive health education to actively championing it. And we've really been able to turn around community dynamics. We've seen incredible engagement and action from parents, teachers, and schools, including mother groups in 3 districts who credit the radio programs with their decision to seek training from their local area health offices on safe sex and FP and reproductive health so they can educate students on these topics in schools. And they're now going into area schools to share what they've learned. Mother groups in Mangochi have gone even further and have started raising funds for girls who are experiencing early pregnancy and early marriage. And the lack of financial support from their families that come along with those to help those girls remain in school. We've seen peer support take many new forms. One of my favorite examples is in Machinji, one of our districts, a counseling group of teen mothers formed after radio programs about how teen pregnancy leads to school dropouts. This group is about 70 members strong now, is still active, and focuses on counseling girls whose families are pressuring them to marry, while teaching them about condom use and safe sex. They've even raised money to cover fees and supplies for teen mothers who want to return to school. And religious leaders, remarkably, who are often among most effective opponents of FP use, have become champions. Churches in several districts have hosted drives for HIV and cervical cancer prevention and have organized community meetings about ending cultural practices that lead to early sex and marriage, following radio programs about those topics. We've also seen youth-friendly health service sites, to Heidi's point about providers sometimes being a barrier. A lot of the workers at these sites have become sensitized to youth needs and perspectives and are better able to respond to them. They've also partnered with our youth listening clubs, with our radio stations, and have distributed tens of thousands of condoms across our districts to youth, including at events with education booths for youth and families. And specifically, in one example, after health workers collaborated with partner stations on a series of reports about female condoms and how they allow girls to exercise more control over safe sex, visitors asking for female condoms quintupled. So I know that was a very brief overview of this activity, but I hope you have a better understanding of how this worked and the kinds of change that it made. And I'd love to dive into Q&A. We have a relatively small group, so feel free to speak up, type a question into the chat. I'm specifically interested to know from this group, do you think this approach is something that could be replicated in other places? Was there anything missing from what I said that you'd like to know about this, how this activity worked? And barring that, you know, maybe type just a one word or a one sentence reaction to this presentation in the chat. I'd be curious to know what you think. Anyone?
I can jump in because I'm too lazy to type, or was starting to type, and then I was like, I could just talk. So hi, Alana.
Hi, Laura.
Nice to see you. I don't know if I feel like I'm in the radio world enough to know if it could be replicated everywhere, but I think it probably could. There's enough, I mean, Africa radio stations, and I think it would be really interesting to look at West Africa because of all the youth ambassador work going on there. Yeah. So getting youth on the radio would definitely be an extra step. My main question was sort of about the hard question about sustainability and like you know, how are you linked? How are the youth and linked to other resources besides our project, and how yeah, who is there to support them now or to keep it going?
Yeah, so, you know, really what's happened through this project, and thanks for asking that question, because I love this activity. It just has generated so many results, including unexpected ones, and I did not have time to describe all of them. So this has really created like a whole ecosystem for support of these young people. And you know, we have a lot of these groups within schools, teachers, school heads, clinic workers, the mother and father groups, supporting these young people and really sort of envisioning a different future for young people. Some results that I didn't mention because the data are a little bit squishy include the young people in our groups, and specifically those who participate in our programs, having a much higher matriculation rate into university than the average in Malawi, which is very low. But they receive funding to stay in school and to go to school from some of these groups. And that all has really been sparked by these programs and by that other activity that's taken place, you know, as a result of the programming and the connections that have been built. And it really starts with the conversations with youth, you know, feeling like they have permission, even though they, you know, they always could have gone out into communities and connected with some of these groups, but they didn't, you know, they didn't feel like they really had the like the social capital to do that. So now that they're doing that as a part of these programs, they're also building relationships with a lot of other groups in the community who are then supporting them. And it's become kind of a virtuous cycle. I see Heidi's question about youth journalists planning for careers. So yes, we know for a fact that multiple graduates out of the program, because they are all mostly teenagers, have gone on to university and to study journalism in particular, which is encouraging. And you know, even those who have gone on to study other subjects have said that the training has really helped them be more effective communicators. So we have heard, you know, a lot of anecdotal feedback around that. So how does the government feel about this youth-led radio program? I see. Yeah, that's a good question. Well, so, you know, the local governments, and I would say that local authorities kind of are in two pillars. So there's the government, and then there are traditional authorities who still have a lot of, you know, control over what happens in communities and a lot of decision-making power. Both of those groups have really bought into the programs and gotten involved. We have consistently seen traditional leaders speaking out on behalf of the programs, talking about how many positive changes they've made, getting really involved in enforcing what are called bylaws, which are not really laws that are written into, you know, official policy, but are sort of like customs that are commonly observed in communities. Those leaders have gotten very involved in, you know, promoting safe sex, in speaking at community events that are about FP use and youth reproductive health, at getting involved with child marriages, to negotiate with families, to try to stop child marriages, you know, getting involved and speaking out on teen pregnancy. And in their role as authorities, that actually has been really helpful because people respect what they say. So, and then, you know, the district level governments have gotten involved. They're frequent sources for our programs. They even have come in to do like call-in sessions at some of the radio stations. And then the national government, we are in touch with the Ministry of Health a lot and other authorities to write those bulletins I was talking about, which are the curriculum for this. And we include their contacts in all of our briefs to the station. So in some cases, they, you know, national representatives have also been sources on the programs. I think the real benefit here is that because the youth and the station mentors are the ones reaching out, you know, they know best how to communicate effectively at all echelons, including with national and local government. These are good questions. Thank you. And I know that we only have 1 or 2 minutes left, but I'm wondering if there are any other questions or observations. If not, I want to thank you all for joining the session and for asking good questions. In a couple of minutes, we will be moving on to round 2.